I'm creating dynamic programming models, so Markov decision process models for chronic diseases. In particular, we're looking at type 2 diabetes and cardiovascular disease. So we're making models that look at the optimal timing and sequencing of blood pressure medications and cholesterol medications to delay heart attacks and strokes. There's oftentimes conflicting evidence about how high risk patients are. So if we look at different clinical studies, they may give different estimates of how likely a patient is to have a major cardiovascular event, such as a heart attack or a stroke. And so what we're doing now is we're using robust dynamic programming methods to kind of resolve some of these differences.
This project deals with a discrete event simulation of two goods-to-person order picking systems on the context of online retail.
What presented here in Informs this year was about the project I did at Memorial Sloan Kettering Cancer Center this summer. The project was about how to make better predictions about the duration of a surgical case. Basically, it was the initial step towards improving the whole surgical planning.
My research is essentially studying car sharing. So car sharing companies like Zipcar and Car2Go. And so we specifically were studying for car sharing companies what strategies you should use to purchase cars, specifically purchase different types of cars so you can appeal to a larger market demographic.
This research is looking at drug shortages and different ways of analyzing supply chain resiliency to determine how we can prevent some of these shortages. This is descriptive work, better understanding when disruptions do occur, how that propagates throughout the system to become a shortage. We're also looking at different types of resiliency in order to prevent some of these shortages.
The focus of my research is in concussion management, and in particular, the topic we're focusing on is whether someone, or is figure out the optimal time for someone to return to play once we know they've had a concussion.
My research focuses on scheduling under uncertainty and applications to healthcare and aviation. And this year at Informed, I was presenting new research related to aviation and delay propagation in the system.
Well, we're considering scheduling colonoscopy patient under uncertainty, no-shows, and duration uncertainty. Scheduling colonoscopy is really important because it's dealing with colorectal cancer, and this is a second leading cause of related death. So we're looking into incorporating all the uncertainty in one model that can schedule patients to reduce their waiting time, to reduce the overtime, to reduce the idle time, and the possibility of canceling the procedure because the patients cannot withstand waiting time.
Our research aims to investigate the existence of sensors which may aid to monitor the equity market. While the classical approach consists in studying the individual stocks, we use the so-called macroscopic view in the equity market. So hopefully this view will enables us to extract significant information about the overall dynamic in the financial market.